to us about recent advances in laser vision correction. You mentioned something people in the industry may understand, SMILE, but for the rest of us that don't know, what is that?
So SMILE, like LASIK, is an acronym. So it stands for Small Incision Lenticular Extraction. So as I was alluding to earlier, LASIK hasn't changed in 20 years. The procedure is the same thing. We need to get to the middle layer of the cornea. So LASIK is two parts. First part, we make a cut, a slice into the cornea, lift this cap up, and then the laser does its correction, and you put the cap back on. And you can see it's a great procedure. SMILE is a newer laser, a different procedure. The laser goes directly to the middle layer, and we remove that small lenticle without making that large cut. So this is advantageous to, I have a lot of active people, a lot of fighters, football players, that kind of crowd that you don't want to have that flap on there. So that SMILE is advantageous to that. Also, a little bit less dryness because you're not cutting those nerves. Another small factor is after SMILE, you can resume full activities. This is really good for active people, and especially ladies. They love that because they can go back to eyeliner sooner than they can with LASIK.
Good point. And you mentioned dryness, too. I hadn't thought about that as maybe being, one of the after effects of surgery, perhaps. With any surgery, is there always going to be prescribed eye drops or some kind of moisture to really help the healing process?
Yeah, interesting. So any eye surgery, whether it's LASIK, eyelid surgery, cataract surgery, it disrupts that tear film mechanism. So this is especially for people who are borderline. They'll notice their eyes may be a little drier than usual. So that's one of the common side effects. Not really side effects. It's a healing issue after LASIK. I always warn patients, your eyes may be a little bit drier than usual. Put those artificial teardrops in your eyes, and for most people, you'll recover. The recovery may be a few days, few weeks, but you'll go back to where you started from. Most of these people, my typical patient that comes in for LASIK is a patient who's worn contacts for years, and they'll tell you, gosh, doc, I used to sleep with them, go out with them all night. Now, 3 o'clock, 5 o'clock, they're really burning. They're killing me.
Yeah.
Well, the contact hasn't changed. What has changed is you've gotten older, your eyes are drier. So it's a piece of plastic in your eye that's just rubbing on your eye. So these patients undergo the procedure, and if you ask them right afterwards, some of them will say, yeah, my eyes are a little dry, but they'll tell you, I'm used to it. I wore contacts. It's not a big deal. Now, if you ask these same patients 3 months later and say, Mrs. Jones, how's your eyes? The majority will tell you, oh, my gosh, doc, my eyes feel so good. I never felt this good in my life. Part of that reason is they don't have that piece of plastic in their eye.
Right.
So that's the most common. Yes, you might get somebody on Google who'll tell you I had LASIK 5 years ago, my eyes are still dry. Yeah, that could happen, but I'm willing to bet those people were borderline dry. They just didn't have the symptoms yet, and the surgery may have pushed them a little bit. I'm willing to bet if they didn't do surgery in 6 months, a year, they would have seen their ophthalmologist or optometrist saying, my eyes are irritated. Why is that? Well, they gotten dry.
Yeah, we kind of tend to forget we're getting older, so our body
Yes.
changes along with our age.